Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
My guest is an expert in the treatment of chronic pain. He is director of a specialized pain clinic. Dr. Christoph Stein, thank you very much for being here today.
Thank you.
Dr. Stein, what would you say from your experience, what are the most common causes for chronic pain?
One common cause is cancer, but many other patients have pain without any identifiable physical cause. Pain can be perpetuating itself, if you wish, and even without any physical damage or any imaging on the X-rays, you can have pain.
Mm-hmm. So what determines whether or not you feel pain when there's no sort of initial or no longer a cause?
Sometimes the nervous system becomes overexcitable. This is what we call, for example, wind-up, or memory plays a big role. And the environment plays a big role. Your family plays a big role. Your work associates, people that are around you, they can reinforce pain behavior. On the other hand, they're also very important because they can reinforce the opposite, wellness behavior.
Mm-hmm. So it's also about how you and your environment sort of perceive the pain and work with it, I gather.
Yes.
And then I read that pain is a very subjective experience. It can't be objectively measured. What determines how strongly we experience pain?
This is mostly a matter of your memory. For example, take two women. One has had childbirth, the other one has not. They both go to the dentist. They both have the same procedure, but they will experience different levels of pain because they compare it to their own personal experience and to their memory of pain.
All right. Well, we said before that pain, when it's persistent, might cause the brain to change. When you're in an acute situation of pain, after an injury, for example, what can you do to avoid pain becoming chronic?
Of course, in the acute situation, you should take medication, but you should go to your physician, and your physician will tell you how much to take. This is one step you can take. It's not a guarantee that chronic pain will never happen, but another important thing is to keep active. Don't lie down too soon, don't lie down too much, and keep active if possible.
So keep active, and pain medication you mentioned. Pain medication is a bit of a tricky issue because there's the question of, dependence there. Many people worry how long can they safely take pain medication without consulting a doctor. What would you recommend?
You can take up to 2 weeks of pain medication in the acute situation. If you have to take medication for longer than that, you should definitely go see a doctor and get advice on how much you can take for how long.
Mm-hmm. We've had a viewer writing to us. Yvonne Sturm from the US has written to ask in about your recommendation on taking opiates for chronic pain. What would you say to that?
Opioids are not very effective in chronic pain. As a matter of fact, we have a very big problem because opioids are prescribed in too many patients, in too high doses, and too many patients become addicted. So you should definitely go see your physician if you really have strong pain and get advice on how long and how much you can take.
Dr. Stein, from your experience in the clinic, what are the most effective elements of multimodal pain therapy?
All elements are equally important. You cannot define one element. Multimodal therapy always consists of typical medical therapy like medication. In addition to that, there is a psychological strategy, and then there is a physical therapy like an exercise program. All these components are equally important.
Let's speak about the psychological therapy. I see, or I read that you're supposed to learn to perceive your pain differently. How can you do that?
Well, if you have a good trainer, a good therapist, you can learn relaxation techniques, for example. You can decrease catastrophizing. This is one example. But it is equally important that you learn how to cope with your own pain and learn that it will never completely disappear. And it's, again, very important that your environment, that your family and your associates that are around you reinforce wellness behavior rather than sickness behavior.
Okay, so what exactly would that wellness behavior comprehend of, and what's the wrong behavior for someone who suffers from chronic pain?
Wellness behavior is getting up, staying active, keeping social contacts, going back to the workplace if possible. And the opposite is sickness behavior. You lie down and stay in bed.
You feel sorry for yourself.
Yes.
And is it a problem that friends and family enforce that sort of behavior? Does that happen often?
Yes, definitely. This is one of the most common causes, or if you will, factors that reinforce pain and maintain.
And are there then people who are more prone to suffering chronic pain?
Yes, you can define certain personality traits. Sometimes you can identify factors in the person's biography that are associated with chronic pain. It doesn't matter. It doesn't mean that you can predict chronic pain from certain factors.
All right. Well, what I'd like to ask you is a question that was written to us by one of our viewers. Alessane de Buru from Benin suffers from back pain, especially after exercising, chronic back pain, that is. So you said to stay active, but what should someone like that do? Stay active even though he's in pain, or stop exercising?
Definitely stay active. I would seek advice from a physical therapist or from a physician and devise an exercise program together with a therapist and make sure that it doesn't overdo it, but definitely stay active.
Mm-hmm. Okay, staying active, live your life despite the pain. Well, that's what I've gathered today.
Yes.
Thank you very much for being with us. Thanks for your time.